if you smash your big toe joint right here, so if it's actually inside the joint, so if you have a fracture that's inside the joint right here, what can happen is you could develop arthritis. So sometimes your podiatrist would need to reset that joint. That's very unlikely to happen with these lesser toes, but it can still happen. So you do want to get that checked out. But the big toe, at the very least, you want to avoid arthritis if it cracks through there. Initially for your big toe, you can take anti-inflammatories, you can ice, you can elevate. People always complain about me saying RICE, rest, ice, compress, and elevate. Yes, there's some debate. The more you control the pain, the slower overall it takes to heal. But everybody's seeing this now with the coronavirus, that big peak. Even though it ends quicker, you want to flatten it out so it's not as extreme and not as bad. So if you're not in a lot of pain, you don't need to take it. But if you're in severe pain and dying of pain, you can't sleep, it makes sense to take it.